Hi, it's Brian Newman with the Spotlight of Business Owner talk show. And today we're thrilled to have Kathleen DeRossett. Hi, Kathleen, how are you?
Hi, how are you?
Yeah, good, good. Yeah, she's got a great business. It's called Time Rebel RN Aesthetics, PLLC. And yeah, before we get into the business, can you tell us a little bit about your background and then how you started?
Yeah, I've actually been in medical for 17 years. Some of that was sleep medicine. I've been an RN for 10 years, critical care for 6 years. All the services I offer, I'm certified in all of them, plus there's continuing education. I've also trained with very experienced nurses, lots of hands-on. And I have a medical director that was an emergency medicine director. So he's amazing. He works off-site. And I actually still work in ICU as my business is growing.
Oh, neat. And can you let people know where is your office located?
Yes, it's on Bell Road, just east of Bream, so Bell and Brookside, and the address is 15142 West Bell Road, and it's suite number 136 in
Oh,
Cypress.
oh, cool. Yeah, so yeah, she's on the west side. Yeah, check it out. What's the best way that people could get in touch with you?
They can do my website, timerebelrn.com. They can message me through that. They can phone me at the number that you've got on the screen. You can reach out to me through Facebook or Instagram, Time Rebel RN. So a lot of different ways, and I'm pretty responsive pretty quickly.
Oh, okay. And are you open on the weekends?
Everything right now is by appointment only, so I have a fairly flexible schedule, so I can definitely work with client schedules. So yes, I have taken appointments on Saturdays and Sundays.
Oh, nice, nice. Yeah, so I was looking at your website and you offer a variety of services. Can you let people know about these services? Some of them?
Yeah, well, one is wrinkle relaxers. People know them as tox treatments or neuromodulators. Botox is one of the four brands available. Everybody's familiar with Botox. The
Yeah.
other three are Jeuveau, Dysport, Xeomin. They're all botulinum type A, but they have very slight differences. Now I'm able to carry all four in my practice. They basically decrease nerve impulses in the muscles that they're injected into. It's kind of like paralyzing so that the wrinkles can appear or are greatly reduced. And some people are starting at a younger age to prevent those etched in lines that we see.
Oh, okay. Oh, wow. Yeah, speaking, so that's called wrinkle relaxers?
Wrinkle relaxers or tox treatment. Yeah, everybody calls them a little bit differently, but the same thing. Yeah, and most people, if they want to treat in between the eyebrows, they call them the levens, the forehead, the crow's feet.
Uh-huh.
Most people need at least 50 units to see a difference, and that usually lasts about 3 months if you work out a lot. Maybe 2 months because then you metabolize faster, but usually between 2 and 4 months, treatments are required.
Oh, okay. And then what about dermal fillers?
Oh yeah, those are great. They're basically injections that contain hyaluronic acid and they work by restoring volume where it's lost. So we all have like fat pads in our face and as we age, they decrease and they sink. So you've got kind of
Oh,
that
wow.
downward pull.
I,
So fillers go in areas like the cheek, the mid face, the chin, sometimes the jawline, and they basically put in where volume was lost. They really give a more youthful appearance. They fill in a lot of deep lines and they correct a lot of sagging.
is that like under the eye?
You can do under the eyes. Usually we start in the cheeks because as you lift, that starts to correct everything else. And then you need
Oh,
less
oh,
fillers in other areas as you start higher up. So gold standard is treating the cheeks first, can go out and here. Both men and women get them. They're great. Some of my people, we do before and afters and they look 10 years younger. It looks amazing.
yeah,
It's
I
a really
saw
great
some of your
product.
pictures. Oh my God.
Yeah.
Yeah, no, they're very, vivid. And yeah, I can see the difference. How much are these treatments?
My practice charges $700 a syringe, and it really depends where you want it. Like if you want to do lips and make your lips fuller, or if someone has really thin lips and wants to make them look a little bit more normal, usually about a syringe is needed. If you've never had fillers before in the cheeks, usually 2 is needed, another one. So it depends what people's treatment goals are. We can start small and build up and make subtle changes, or people can go big, which they have done.
Oh, okay, okay. No, I noticed even myself as age has creeped up on me, like my neck is like I don't know, I don't know what you call it. It's just like a chicken neck, I guess. That's what people say. Do you have any treatments for that?
So there are treatments for the neck. Oh, by the way, I forgot to mention a lot of fillers. They usually last at least 15 months. So they last a lot.
Oh,
They're more expensive than tox treatment or wrinkle relaxers, but they last a lot longer. Yeah, there definitely are treatments you can do for the neck. I don't do all of them right now, but there's different types of filler that you can dilute and put into the neck. There are different microneedling with radio frequency treatments you can do. There's different laser treatments. So there are a lot of things that can be done for the neck. I don't do all of them yet, but I will be doing a lot of them as my practice grows.
oh, okay. Yeah, again, I want to remind the viewers that we're talking to Kathleen DeRossett. She's with Time Rebel RN Aesthetics. And, again, what's the best way to reach out to you? Can they call you and ask you questions? Do you have a website that they can go to and even sign up?
Absolutely. It's timerebelrn.com. Facebook and Messenger is timerebelrn, and then the number you provided on this screen. So you can message me any way. I usually get back pretty quickly. Sorry, I've got a golden retriever in the background.
Oh, that's okay. Oh, wow. Maybe he wants to be on the show,
Probably, most likely, knowing Rosie.
Oh, wow. No, so you know, ideal clients. Who is your ideal client? And are there
Yeah.
patients that would basically steer away from getting this done?
Yes, to both questions. So yes, ideal clients is people really wanting to make positive changes in their life. With my motto, it's supporting you in your own unique skin so that you can feel confident during the aging process, looking your best at any age. So anybody that looks in the mirror, they don't recognize themselves, they have insecurities. Anybody who really wants to feel more confident and is willing to put in the work, and sometimes a little discomfort, a little pain, but yeah, I'm one of those people that really want to work with me on a treatment plan to come up with what they want, and I really enjoy doing it. The people that would stay away from treatments, a lot of treatments, would be people that aren't in overall good health. People on blood thinners, they would definitely want to check with their doctors before seeing me or anybody like me, and make sure that they have a plan with their doctor if they need to hold off on blood thinners, or if their doctor's like, no, it's not a good idea. So you do want to be in fairly good health.
Oh, okay. And then can you just remind everyone also about what's permanent, what is just temporary treatments?
Pretty much the only thing permanent is facelift.
Oh,
And I have another guest in the background joining me.
okay. Oh,
So with aesthetics, a lot of things aren't permanent. Eventually the wrinkle relaxers wear off. Eventually the fillers disintegrate. When I do microneedling, usually 3 treatments 30 days apart are needed. If you stop doing that eventually and don't take care of your skin, that'll go back to where it is. Chemical peels. So nothing I do is completely permanent.
okay.
And nothing I do causes scarring or anything like that. So that's actually the good thing, is nothing is completely permanent. But the bad thing is you do have to keep taking care of yourself and keep repeating treatments every now and then.
Oh, okay. Do you have to avoid the sun in any of these services?
Some of them, yes. Now I always recommend sunscreen. I retail PCA Skin, which is Arizona based, and they have some great sunscreen. So before we go into that, everybody should wear sunscreen all the time. But there are some things like microneedling. Your skin is very tender. Chemical peels expose skin, so you would want to avoid the sun for a couple days and wear sunscreen, protect your skin. But it's when anything I do, you don't have to permanently stay out of the sun, but you do need sunscreen.
Oh, okay. So what do you enjoy the most about your work and business?
You know, I'm really excited to meet people that take care of themselves. You know, we meet for consultations, we discuss goals, we usually combine treatments, and it's really amazing to look at the before and after photos. Such a positive difference. The client feels younger, they look refreshed, they look great. So it's nice to see positive changes. In the ICU, I don't see that. It's been interesting during COVID. So it's really nice to see the positive end of medicine in the medical spa business, and really seeing people happy.
Oh, yeah. No, I understand. No, and then what's the appeal of aesthetics?
Really just dealing with the aging process. Everybody deals with it. So everybody wants to feel more confident. Some people are in jobs where you have to keep that youthful appearance. So it's really about self-care and feeling confident.
Oh, okay. So again, we're talking to Kathleen DeRossett. I hope I'm saying that right, with Time Rebel RN Aesthetics. Can you again remind people what's the best way to reach out to you and get in touch?
Sure, my phone, it's 623-640-6228, the one you've got on the screen. It's you can text with that one. You can go to timerebelrn.com and message me through my website. You can go to Facebook or Instagram under Time Rebel RN as well. Can message me there, and I usually respond back pretty quick unless it's after 9 because I wake up early.
Oh, okay, okay. I know myself, I've heard the term, what's it called, needling,
Microneedling. Mhm.
micro needling versus chemical peel. So
Yes.
what's better, for someone that's had acne for
Mhm.
years?
I would say microneedling, they're both beneficial, but microneedling works deeper. It's also known as collagen injection therapy. It's basically tiny needles. I use a pen that has a motor. It pricks the skin to create micro injuries, and these injuries or punctures, they close up almost
Oh.
immediately. Hang on one second, Rosie, do you want to come join? So that these can diminish fine lines and crepiness, but they also can decrease scarring, sun damage, stretch marks. Um, she has something to say, hyperpigmentation. It can be used anywhere on the skin. And some people like really treating the chest and neck, but you can really use it on
Oh,
any body part. And what's good, it's good for all skin tones, because some skin tones, if you're darker, some treatments aren't good for you, but microneedling can be used on all skin tones.
oh, okay. Yeah, we live in the Sun Belt, we're here it's
Mm-hmm.
sunny like almost every day, thank God. I'm from Ohio originally, and we didn't see the sun like all winter long for months, and I really love it. But um, would you advise people, I mean, when they go out, like to play golf or pickleball or whatever, I mean, should people wear sunscreen, or
Yes.
what do you recommend?
Absolutely. Not only should you wear sunscreen when you're outside all the time, but you should also wear it inside. Even these fluorescent lights in a lot of offices can cause mild burning and sun damage over the years. So even indoors, you should always wear sunscreen on your face and neck if your arms are exposed. Use it on your arms. Sun damage can cause a lot, including skin cancer.
Oh, okay, okay. And then one final question I was going to ask you, like, do you offer packages to patients?
Yeah, not on all the products, like the Wrinkle Relaxers and Derma Fillers, that would be a single treatment. But with microneedling and chemical peels, if you buy packages of 3, there is a discount.
Oh, okay, okay. No, so yeah, thank you again, Kathleen, yeah,
Yeah.
for being on the show. And again, if you're watching this, I highly encourage you reach out to her. She's got an office right on the west side, conveniently located right off of Bell Road in Surprise, I believe you said,
Mhm.
right?
Yeah.
Yeah, so yeah, check her out. So yeah, thank you, Kathleen, for being on the show.
Thanks for having me.
Okay, thanks.